my last video, I shared how a random Instagram reel introduced me to bariatric surgery and started months of research that completely changed my perspective. But as I continued learning, I discovered something I didn't know before. Bariatric surgery is not just one operation. There are different procedures and each one works differently. So before I could even think about making such a life-changing decision, I wanted to understand every option available. The first thing I learned was that bariatric surgery is not cosmetic surgery. It is not designed to help someone to lose a few kilograms before a special occasion. It is a medical treatment for people living with severe obesity, especially when lifestyle changes alone have not resulted in long-term success. These procedures work by helping you eat less, reducing hunger, changing the way your body responds to food, or in some cases, reducing the absorption of calories. But something every doctor emphasized was this, that surgery is a tool, not a cure. Without healthy habits, even surgery cannot provide lasting results. The first procedure I learned about was adjustable gastric band surgery, often called the gastric band. In this procedure, a soft silicone band is placed around the upper part of the stomach, creating a much smaller pouch. Because the stomach becomes smaller, you feel full after eating much less food. One advantage is that the band can usually be adjusted or even removed if needed, making it the most reversible of the common bariatric procedures. However, I also learned that it requires regular follow-up appointments for adjustments, and weight loss can sometimes be slower compared to the other procedures. Some people may also experience band-related complications over time, which is one reason it is performed less often today than it once was. The second procedure is Rox-and-Y gastric bypass, commonly known as gastric bypass. During this operation, the surgeon creates a small stomach pouch and connects it directly to a lower part of the small intestine. This means food bypasses most of the stomach and the first part of the small intestine. Because of this, people usually eat much smaller portions and also absorb fewer calories and nutrients. Gastric bypass has been shown to be very effective for weight loss and can significantly improve conditions such as type 2 diabetes in many patients. But because part of the digestive system is bypassed, there is a higher risk of vitamin and mineral deficiencies. Lifelong nutritional monitoring and supplements are essential, and some people may experience dumping syndrome where eating certain foods, especially sugary foods, causes nausea, cramping, dizziness, or diarrhea. The third procedure I researched was sleeve gastrectomy, also called LSG, laparoscopic sleeve gastrectomy, and in common language it is called gastric sleeve. During sleeve gastrectomy, approximately 75 to 80% of the stomach is permanently removed. The remaining stomach becomes long and narrow, almost like the shape of a banana. Since the large portion of the stomach is removed, the body also produces much less ghrelin, often called the hunger hormone. For many people, that means reduced hunger, fewer cravings, and better control over portion sizes. Food still travels through the digestive system in its natural order. Unlike gastric bypass, the stomach and intestines continue to work along their usual pathway, although the stomach itself is much smaller. Even so, sleeve gastrectomy is still major surgery. Patients must commit to lifelong healthy eating habits, regular exercises, vitamin supplementations when prescribed, and ongoing medical follow-up. After learning about all three procedures, I realized something very important. There wasn't a best surgery. There was only the surgery that would be most appropriate for each individual depending on their health, medical history, lifestyle, and the advice of an experienced bariatric surgeon. Every procedure has advantages, every procedure has limitations, and every procedure also comes with risk and lifelong responsibilities. That's why I never wanted to choose based on social media or someone else's success story. I wanted expert guidance for my own situation. Once I understood the different procedures, it was time for me for the next step, finding the right surgeon. I started researching bariatric specialists across Pakistan, reading reviews, comparing experiences, and making a short list of doctors I wanted to consult. Eventually, one consultation changed everything. In the next episode, I'll share how I chose my surgeon, which surgery he recommended for me, the questions I asked, and the risk he explained, and how I finally made one of the biggest decisions of my life. Research gave me knowledge, but meeting the right surgeon gave me clarity. And that clarity gave me the confidence to move forward. Thank you for watching, and I'll see you in the next episode.